Thank you.
Always good to talk to you. Now, goodness me, you've been talking about this stuff for so long, not in your specialism, but also when you were campaigning during the early lockdown, say, for goodness sake, we can't stop all this cancer treatment. Things have improved a bit since then, but basically we're still years behind in the NHS on NHS treatments and the amount of time it takes to get them and the treatments you get. Why?
It's inexplicable. I've been in oncology for cancer medicine for nearly 50 years, for junior doctor and then consultant. And we've always had this problem and no one's sorted it out. I mean, what's happened today is there are a couple of papers, one on radiotherapy access and one on chemotherapy access, comparing 4 countries, Norway, Canada, Australia, and Britain. And not surprisingly, we come up worse on all of them. Delay to getting started on treatment, the percentage of patients getting treatment, and not only that, the age gradient for getting it. In other words, in Britain, older people tend to get left behind. They don't get treated for some reason.
I was amazed when I saw those stats, that the number of people, say, in their 80s who they've got cancer, who get treatment in, say, Canada or Norway, compared to maybe 14%. Only 2% in this country, and basically saying, well, basically, you're going to die soon. Let's not bother. Seems to be the attitude in this country.
And of course, the data comes from 2012 to 2017, so well before COVID. So COVID has made it much worse. If you did this study,
COVID didn't make it worse.
Much worse.
Lockdown policies, NHS policy made it worse. We mustn't give in to that. And you were talking about that from early days. You've also talked and campaigned an awful lot about the NHS using all the private cancer facilities, which have just been left completely empty.
I mean, the problem we've got is that there is huge backlog, and we're not keeping up with the backlog. We're not into a steady state yet. The only way to deal with that is use the private sector to help clear the backlog. Pay people overtime to come in at weekends. Most hospital car parks are completely empty at the weekend. It shouldn't be like that. We should be full with people. The equipment's all there. Rather than build more centres to work 9 to 5, 5 days a week, let's use it more effectively. Sure, to get rid of the backlog will cost money. We did it for COVID. The vaccine programme was a logistic triumph for the NHS. But we can't do it for cancer. We can't do it for heart disease. Why not?
It's quite bizarre, isn't it? And again, whatever it costs, it will be worth it. These people will be able to have longer lives, more likely to live, carrying on working, paying taxes, looking after their children. Life is worth something, and it's certainly worth that. It is bizarre, as you say, that we've got all this amazing equipment, all these specialists, and they're basically acting as if cancer is 9 to 5, Monday to Friday, when it isn't.
The biggest problem why our survival figures are much lower than the rest of the world is simply the diagnostic access. You can't get an appointment for the GP. That's the first problem. When you do, the 2-week wait has been abandoned. People are waiting 2 months, just knowing the GP knows you've got cancer or very likely to have cancer, makes the referral, and you wait 6 weeks. I mean, this is ridiculous.
We've seen only 50% of people who were supposed to see a consultant in the correct time frame, I think a couple of months, are even seeing them then. Of course, we've got King Charles, who obviously got treated very quickly in private healthcare. I was calling out saying, if a politician did that, everyone would be up in arms. But why do we expect any one person to get a better treatment in this country than any other? But again, the wonderful NHS, best in the world, unless you want to stay alive.
Exactly. And, good old King Charles, I think he is the king, so even the NHS would have treated him quickly, I'd like to think. But it is painfully slow. Not only that, it's one thing after the other. It's like going through an airport when it's busy, and you have to queue, serial queues. It's exactly like that to get started on cancer treatment, just serial queues to get going. The target is 62 days, which is incredibly generous. If you're an American, you'd sue the government if you had to wait 2 months to get cancer treatment.
And why are you not seen in 2 days, not 6 years? It is extraordinary that we've accepted this, but the awful thing is, if you're sharp elbowed middle class, you often have a way to go through, even if you haven't got the finances, as lot of those people do, to go private, to jump that first queue. Everyone else left by the wayside. Karol Sikora, thank you so much for joining us. Always appreciate you joining us. Fantastic that. Philip Ingram, this is really worrying. You said you got treatment during lockdown period, and thank goodness you did for cancer, but millions of people are not getting getting treatment they need. People are dying as a result of that.
Yeah, there's too much of a postcode lottery. And is it down to government policy? Is it down to
Funding?
poor management? Is it down to funding?
I think it's down to all of those things.
As Karol Sikora said, he can't put his finger on what it is. We should do better in.
But again, there's no doubt at all that we did improve massively in the years. I think actually under Tony Blair and Gordon Brown, and then from 2010 onwards as well, of the Tories, we were improving. But again, from a very low base. That said, we pay a lot less for our healthcare than many of those countries do. But we also have a completely different system. Where we don't have one big monolithic healthcare system, where we have choice.
And this is where I think we need to look at the NHS in the round. The NHS isn't about jobs and buildings and all the rest of it. It's about
outcomes for patients.
Outcomes for patients.
That's absolutely key focus, isn't it? That's why he's a military man. He does facts.